Hello, welcome back. Let's talk about the outcomes of inflammation. The ideal outcome of the acute inflammatory process is complete resolution and healing. As we have seen, this does not always happen. For example, in the case of infectious diseases, there is always the possibility the infection will spread. There are two ways to heal. When the injury is limited, or there has been no or minimal tissue damage, and when the tissue is capable of replacing any irreversibly injured tissue cells, the usual outcome is restoration. The second type of healing is scarring and fibrosis. It results after substantial tissue destruction or when inflammation occurs in tissue that does not regenerate. In addition, extensive fibrinous exudates may not be completely absorbed. Delay and persistence. Depending on the extent of the initial and ongoing tissue injury, as well as the capacity of the affected tissues to regrow, acute inflammation may be followed by chronic inflammation. The patient risks spread of infection if the immune system is unable to contain a given infection. This dissemination may occur through several routes. First, direct spread. Pathogens enter tissue space or natural tract, affect surrounding tissue or organs. For example, TB of kidney spread to the urethra and even bladder. Second, lymphatic spread. Pathogens enter lymphatic and cause nephritis. The most serious outcome is spread via the bloodstream to distant parts of the body. The following terms describe the possible sequence of events. The first one, bacteremia. The simple presence of bacteria in the blood. Toxemia. The release of bacterial toxins into the blood. Septicemia. It refers to the strong toxic bacteria propagate in blood and release toxin to cause severe systemic symptoms and lesions. Pyemia. It refers to the spread of infection by infected microthrombi, giving rise to widespread formation of abscesses. Now, let's move on to the last section, significances of inflammation. Inflammation is a protective response whose ultimate goal is to rid the organism of both the initial cause of cell injury and the consequences of such injury, the necrotic cells and the tissues. Inflammatory response is closely integrated with the process of repair. The inflammatory response occurs in the vascularized connective tissue. Inflammatory response of both vascular and cellular response are mediated by inflammatory mediators derived from plasma or cells and triggered by the inflammatory stimulus. However, inflammatory responses are not perfect. That may be potentially harmful. Here is some homework for you. These are the main points of this chapter. All for this chapter. Thank you.